press conference over to Health Director Gibbie Harris. Gibbie.
Good afternoon, everyone. Thank you for joining us this afternoon. I have with me Dr. Meg Sullivan as well. We have, again, some brief statements to provide to you, and then we'll be happy to answer questions. So I will start with a brief update on where we are with our metrics. At this point in time, we are currently basically plateaued with our metrics. Our trends indicate, though, however, that we are still at significant risk of transmission in our county. We continue to have high levels of virus, and so the intent, obviously, is for us to continue to avoid another surge of virus in our communities, which means we have to continue to adhere to the public health prevention measures that we have been talking about and that everybody has been living in for the past year. We will encourage people to continue to mask, socially distance, and avoid large crowds. The other concern that we have in our community, obviously, is the ongoing issue of and potential of variants that increase the likelihood of transmission in our community. At this point, we are seeing some limited data that is providing some increased evidence of the UK variant, the B117 variant in our community. What we know about this variant right now is that there is an increased risk of transmissibility from this particular variant, especially in our younger populations. And so we will need to continue to stay focused on that, and it really reinforces the need for those who can be vaccinated to be vaccinated so that we can protect our younger citizens here in Mecklenburg County. With our vaccinations, we continue to, continue to see increases in the availability of vaccine until we hit a little bit of a glitch today with J&J, and we will talk about that in a minute. But as you know, at this point in time, everyone over the age of 16 and up is eligible for the vaccine, and we're continuing to strongly encourage everyone to be vaccinated as soon as they can get an appointment or can find a place to be vaccinated. At this point, Pfizer has also requested approval from the FDA to vaccinate 12 to 15-year-olds. We anticipate approval of that within the next month at the very latest. So we will be continuing to work on distributing our vaccine equitably throughout the community and leveraging and organizing our resources across all of our partners. At this point in time, we are 28.4% partially vaccinated in Mecklenburg County and just shy of 20% fully vaccinated. So we have obviously a good ways to go. I think everyone is aware at this point that there is a pause on the use of J&J at this point. There are issues with a very rare number of cases of a type of blood clot that is severe. It's about 1 in 1 million when you look at the number of doses of J&J that has been distributed up to this point. We know from the federal government that they are working quickly to analyze the situation and to make recommendations on how we move forward with J&J. They actually expect to be able to make some decisions about that in a few days' time. And that's both the FDA and the CDC. So at this point, we are, however, pausing the use of J&J in our community, both us as well as our other vaccination partners in the county. And at that point, I am going to turn it over to Dr. Sullivan to let everyone know where we are with our vaccination clinics and how we're moving forward with Pfizer and Moderna.
Great. Thank you, Gibbie, and good afternoon, everyone. So I think first and foremost, I want to say that we continue to be highly engaged in our COVID vaccine efforts as an important pillar to help us protect the community and prevent further illness and death from COVID-19. We continue to provide vaccine at our fixed locations through multiple community events, through our homebound vaccine program, as well as transfer vaccines to enrolled providers throughout our community. It's an important to note, over 121 million people in the United States have been vaccinated with at least one dose of the 3 authorized vaccines. And we really do have really good real world evidence of the effectiveness on the disease, of the vaccine on preventing COVID-19 infection, hospitalization, and death. So to follow up on Gibbie's comments, as you know, this morning we did learn that the CDC and FDA recommended a temporary pause on the administration of the J&J vaccine while they're reviewing data involving a very small number of cases here in the United States of a rare and severe type of blood clot in individuals who received the J&J vaccine. Again, this pause is being recommended out of an abundance of caution, and I think further highlights the fact that COVID-19 vaccine safety, it has been and will continue to be the top priority throughout the entire vaccination process. I think a couple of important notes about this announcement. To date, there are no reports of this occurring in the Pfizer and Moderna vaccine, and there have been no changes in recommendations to continue the Pfizer and Moderna vaccine, which remain very safe and effective vaccines. And as Gibbie noted, we continue to encourage everybody who ages 16 and older to make an appointment to receive a COVID-19 vaccine if they have not already been vaccinated. Second, I want to stress again, this is an incredibly small number of case reports that have led to this announcement, and to reassure individuals that have received the J&J vaccine or any of the COVID vaccines that there are no specific actions they need to take at this time. All patients receive counseling prior to receiving the vaccine about common post-vaccination side effects that may occur within 1 to 3 days after receiving the vaccine and resolve within a short time. These are normal post-vaccination side effects that are not concerning. The case reports referenced in this announcement had symptoms that occurred about 1 to 3 weeks after receiving the vaccine and involve very severe persistent symptoms, including headache, leg pain, abdominal pain, and shortness of breath. And just as we would encourage any individual in any situation, any patient with severe persistent symptoms should call their medical provider, seek medical attention. But again, to emphasize, this so far has 6 cases out of 6 million doses. And again, individuals who have been vaccinated and do not fit in this category should be reassured and know they are now have a high level of protection against COVID-19. I also want to note, as Gibbie mentioned, that as we routinely do with all guidance, we will be adhering to this guidance and we'll be pausing our Johnson & Johnson vaccination efforts and instead modifying them to be providing Pfizer or Moderna instead. So specifically today, we had 2 events that were impacted. The first is a vaccine event this evening with the Salvation Army, where instead of providing Johnson & Johnson vaccine, we will now be providing the Moderna vaccine to all those that had appointments and that show up for vaccine. The second is we had homebound vaccination appointments that were scheduled and we're anticipating providing the Johnson & Johnson vaccine. Instead, we were able to keep the majority of those appointments and we'll be providing the Pfizer vaccine instead. And over the next few days, we'll be working to vaccinate as many of our homebound vaccination appointments that were scheduled this week, again, either with the Pfizer or Moderna vaccine while this pause is in place. Finally, we have our large Camp North End event planned for this weekend, which we will be continuing that event and we'll be using the Pfizer vaccine instead. And that link is available. And we're really encouraging people to sign up and make an appointment for that event. So the last thing I'll just say is we'll obviously continue to monitor the guidance and information carefully and provide updates as information become available. But again, want to continue to stress we have full confidence in the vaccine efforts and encourage everyone who has not yet been vaccinated to do so.
Thank you, Dr. Sullivan. First question today is jbruno, WSOC TV.
Hey, y'all. How does the risk of getting blood clots from a Johnson & Johnson vaccine compare to the risk of getting blood clots from, say, smoking or taking birth control?
I think it's a good question, and I think this is, again, what we know right now is this is an incredibly low number, as Gibbie said, kind of 1 in a million cases so far based on the number of doses that have been administered. So it's incredibly low. And I know that there's more investigation that's happening. We expect more data to come out about that. I think one of the things, though, that is important to emphasize is this type of severe and rare blood clot is different than those types of blood clots that you referenced that you may see in someone who is smoking or on birth control. So I think it's hard to compare them. This one is an incredibly rare type, and it's hard to talk about that prevalence. But again, I think it is important to note that so far it's been rare compared with the number of doses that have been administered.
Next question, Hunter Sáenz, WCNC.
Hi there. Thanks for talking with us today. I do want to just ask, I know there are several people in our community who are already hesitant about the vaccine. With this J&J news, what is your biggest concern as we continue this vaccine rollout, specifically with some of these clinics that were purposefully put in certain communities?
Well, obviously, it is a concern when you have problems with vaccine like this that it will impact the overall vaccination process and program that we have in place at this point. As Meg said, and we continue to re-emphasize, there is no indication at this point in time that there's any problem with the Pfizer and the Moderna vaccine. There have been millions of doses provided. We have not seen anything like this with those particular vaccines. And we are continuing to encourage people to get vaccinated. The thing that it's a balancing act. It's always a balancing act. I mean, if you actually become infected with COVID, there's risks there as well. And what we are seeing is a much lower risk with any kind of issue from the vaccine than actually becoming infected with the virus. And again, the vaccine is that plus all of our prevention measures is what's going to help us begin to normalize some in our community. So we need people to continue to have faith in the vaccine and to continue to move forward with accessing it as quickly as they can. So obviously it causes some concerns. We'll continue to communicate and to educate as much as we can and to be as transparent with everything that we know about these vaccines as we move forward.
Next question, Caroline Hicks, WBTV.
Hi, how will this impact you guys in terms of supply? Will you have to throw out any of the J&J doses that you were planning on using today or this week? And then I know we've talked about, some of the demand going down. So with the amount of Pfizer and Moderna that you guys have, do you feel like you guys are doing, well in terms of supply, or do you think that, this pause will slow down vaccination efforts in terms of the supply that you can use?
The J&J doesn't get tossed. We continue to store that appropriately. We just got off a call with the state as well. We do know that the federal government has stopped shipping J&J at this point in time. So we'll wait and see what happens with that based on recommendations from the FDA and the CDC. Currently, we have sufficient vaccine with Pfizer and Moderna to get through our clinics this week and to address the appointments that we already have. The state has also told us that there is some additional supply that we can access if we need to. So at this point, we don't see a particular problem with supply as we move forward.
Next question, Alison Kuznitz, Charlotte Observer.
Hi, it's Allison from The Observer. This is a question probably for both Gibbie and Dr. Sullivan. Can you talk about now giving some vaccines to marginalized communities who are really banking on coming once and being done with the vaccine, how you'll make sure that those people do come for their second dose, and also how you'll maybe change your messaging around that some people who are already on the fence kind of have a new reason to be hesitant?
Meg, I'll let you tackle that one.
Yeah, I think I'll say first, I think with the first question, I think one of the biggest advantages of the Johnson & Johnson vaccine is that it is a single dose. And I know that was definitely appealing for a lot of individuals. And we were intentional in some of the programs about why we were using that vaccine, for example, in the homebound vaccination program, which is a really resource intensive program. And so switching to Pfizer or Moderna obviously adds the number of resources that we need to put into it. So, I think it's just recognizing that right now we have the Pfizer and Moderna vaccine are the vaccines that are available. We've always said kind of take the vaccine that's available to you to recognize the benefits of it. And we want to continue to get as many people vaccinated as quickly and equitably as possible. And so again, in the immediate short term, as we wait for additional data and guidance to be coming from the federal and state level, we will shift to using those 2-dose vaccines in places where we may have used the one, but we'll continue to reassess that as more information becomes available. I think the second question around, individuals who already had questions or concerns about the vaccine. One of the things that I do think is important to emphasize is that, this is, again, a very small number of cases that we saw, but I think it shows that when in doubt, it is erring on the side of caution, and safety really is the top priority. So even with this very small number, the decision to pause in some ways can provide that reassurance that safety comes first, and that, just let's take a little bit, let's make sure that we truly are looking at all of that data, have all of the information, and every single decision or recommendation is based on science, is based on data, and based on the facts. And, based on that information that comes out, again, to be reassured that there's a lot of people that are looking at this, every vaccine, kind of being monitored, even after people are receiving the vaccine, and really encouraging individuals also, once they receive the vaccine, to sign up for what's called a V-Safe program, which is through the CDC, so they can report any symptoms or side effects they're having, that this is a huge focus of the vaccination efforts and will continue to be. So hopefully having some reassurance in that.
Next question is Chloe Leshner, WCNC.
Hi there. Just wondering if people who are maybe prone to blood clots should avoid getting the Johnson & Johnson vaccine even once this pause is lifted?
I think as the analysis and the review gets done by the CDC and the FDA, they will help determine, as part of that process, if there are specific individuals who should avoid the J&J vaccine. So we anticipate that being part of what comes out of that review, and we'll pay attention to that once we get that information.
Next question is Katie Peralta Soloff, Axios, Charlotte.
Good afternoon. I was just curious, do you guys know how many J&J vaccines the county has administered thus far?
I don't think we could figure that one out, but we don't have that number with us at this point.
Is it fair to characterize that number as a smaller chunk of the overall vaccination process?
Absolutely. Obviously, J&J came out later, and we've been providing Moderna and Pfizer since late December. So yes, it is a small percentage of the vaccine that we've given up to this date.
Next question is Claire Donnelly, WFAE.
Hi, yeah, in a similar vein, I was wondering how many appointments you're anticipating having to switch to Pfizer. Like, how many folks were you expecting to vaccinate with Johnson & Johnson in the homebound program, for example?
Yeah, so this week we had, and sorry, I'm going to do the math in my head quickly, approximately 70 to 80 appointments that we are planning to do in the next 3 days for our homebound vaccination program. And so again, we're working to accommodate as many of those as possible, and we'll be using either Pfizer or Moderna for those. The Salvation Army event that we had this evening, we expected to vaccinate between 50 and 100 individuals. And then again, the Camp North End event will be switching to Pfizer. But our plan is to accommodate everyone who had an appointment. We don't anticipate this having a huge impact on the amount of vaccine that we are offering or able to provide this week.
And how many people were going to be at the Camp North End event?
So we're hoping to vaccinate up to 2,000 people at that event. We still have slots that are available, and so we're still encouraging people to sign up for that.
Thank you.
I want to get Ryan Pitkin in for a first question. Ryan Pitkin, Queen City Nerve.
Yes, as far as the supply of Johnson & Johnson that you do currently have, you'd said that none are going to be thrown out. Is there a certain shelf life there that you would need federal government to come through with their recommendations so that those do not get thrown out? And do you have an estimated number of the supply that you do have currently on hand of Johnson & Johnson?
Yeah, so we currently have about, or when expecting based on the shipment, we're receiving about 2,000 doses. That's an estimate, but somewhere around there. Every vaccine that comes with an expiration date. I don't know the exact expiration date of the vaccine that is arriving this week, but it is not imminent. And so I think, yes, while we want, and the government is committed to reviewing this as quickly as possible and providing information as quickly as possible, and obviously having that expiration date in mind, we don't anticipate reaching that level before we have additional information.
The information we got from the federal government and from the state today is that they anticipate having this assessment done and recommendations within 2 to 3 days. So there's going to be very quick turnaround on that, which should help us with the expiration date on any vaccine.
Next question, go back to Hunter Sáenz, WCNC.
Hey there, Gibbie. Quick follow-up. It seems that supply has really ramped up, and we're seeing a lot of places, including like some Star Med locations, people reporting that there's no wait at all. Is it starting to be a concern that with only 20% of our community fully vaccinated, that now supply is exceeding demand because there may be no big want as there once was for these vaccinations?
That's a great question. And I think that there are probably a couple of things going on here. Number one, we do believe that the supply has balanced out with demand. That happened fairly quickly, and we're pleased to see that there's enough supply here for anyone who wants it. I mean, the other thing that we're taking a look at and having conversations with our partners about is whether we need to think differently about how we make vaccine available in our community so that it's very easily accessible and so that people don't necessarily have to plan a lot to be able to get the vaccine. So you are going to see more walk-in, walk-up opportunities, drive-throughs, those sorts of things, as well as I believe that Publix started providing some vaccine, Harris Teeter's providing vaccine. More and more pharmacies are providing vaccine. Doctors' offices will be providing vaccine. So it becomes more readily available and more accessible for people. So I think that's what folks are thinking about. We're not getting huge messaging that people just don't want it. It's just, it's not front of mind as it was for a number of people in the early stages. So we just need to continue to encourage people to be vaccinated, but also continue to make it as accessible and available as possible so that it's easy for them to get the vaccine. And that's what we'll be doing over the next couple of months.
Thank you.
Next question, going back to jbruno, WSOC-TV.
Knowing how this announcement has already created hesitancy and it will create misinformation in the future, given that out of 7 million J&J shots being in arms already and only 6 cases of these blood clots have been reported, is pausing worth it?
That's a great question, Joe. And I think, I think as Meg said,
a little jumpy. Yeah.
Worried for your friend.
Yeah. Other than that, I just hope everybody makes it out safely and no one gets hurt.
Thank you so much.
Thank
Appreciate
you.
your time.
Thank you.
Thank you. Thank you, Paul.
Oh, yeah.
Hey, I had just spoken to you. I'm at the back end. Are you going to try to come in the other end of it? Are you going to Brantford? You're not going. Oh, I heard.